Do you think that there is a traditional practice that has been bastardized or poorly understood by Western medical professionals like myself?
Like we were discussing ibala, a lot of medical doctors say ibala, it's harmful. It will go away. Just, don't do anything to the child. So we believe that people that believe in African spirituality, we believe that it needs to be treated because it is a life-threatening illness. So I think there's a conflict between traditional healers and medical doctors.
Hello and welcome to Tiny Matters with Dr. K, the show about tiny people that chats about childhood in the big ways that matter. I believe as a pediatrician that the best kind of medicine does not start with a prescription. It starts with listening and understanding. And part of that listening and understanding is respecting the traditions and cultures that have taken care of our patients and families for generations. Today's conversation is not a conversation that happens often, but one that I'm so excited to have, marking the point where traditional care meets modern medicine. And to do that, I'm joined by someone I've been truly looking forward to speaking with, a traditional healer who is respected by her community and a voice in caring for children and mothers alike, Dr. Nomadlozi, or as many like to call her, Gogo Nomadlozi. Thank you so much for joining me.
Thank you, Dr. K, for having me. It's such an honor to be here.
Tell me who you are. Outside of being this respected traditional healer,
Yes.
Who are you when you're at home with your family?
Okay, I am Dr. Nomadlozi. I'm not a medical doctor. A lot of people from social media spaces refer to me as Gogo Nomadlozi. Some say Umbelethisi. Gogo Nomadlozi was born, bred, and battered at Snake Park, Soweto. That's where I had my whole life there. And I was raised by my maternal grandparents. I'm just from a huge family. And when I think of my childhood, I think of it as I grew up in a household where there was just a lot of people, my aunties, cousins, everyone living under one roof.
Yeah.
I am a wellness registered counselor by profession.
Okay.
I studied psychology. I'm still furthering my studies. I'm on the honors level at the moment, currently. And that is Dr. Nomadlozi. I'm very loud. I'm very loud. I love people. I'm an extroverted introvert. That's how I always describe myself.
I'm that too.
Yes. Yes. So I'm a social butterfly. I love being around people. I just love, traveling as well. Mm. Yeah, but sometimes I just, want to be in my bubble, in my cage, and just not engage with anyone. I don't know if that makes sense, but I'm an extroverted introvert. I'm very passionate about helping people, hence I'm in the mental health fraternity. I pursued my career in the psychology field.
And I imagine that brings such a richness to what you do,
Definitely.
being able to care for the whole person,
definitely.
You have come from such a rich, culture and this big family.
Yes.
And I think it's that diversity. We always say it takes a village, right? It
definitely,
takes
precisely.
A village. But growing up, when did you know that at least the traditional medicine part of what you do is the route that you're going to take? Like when did that start to kind of shine through for you?
Okay, so as far as I remember, growing up, I've always been a different child.
Yeah.
Amongst my siblings, I've always been an outlier, if that makes sense. Mm-hmm. Yeah. And I started having spiritual episodes, I think around my teen years. Mm-hmm. That's where I had, that's when I realized that I had a calling.
Yeah.
To be a traditional healer.
Yeah.
Yeah, but like any other 13-year-old, I didn't really pay attention to that. Yeah.
Yeah.
So just growing up, I got a lot of support from my grandmother.
Okay.
She is my pillar of strength. Yeah, she understood what African spirituality is. And before I got initiated, she was already practicing
Okay.
as a traditional healer. I can say as a traditional healer, but she didn't go through the initiation. But a lot of practices that have to do with in rituals within the African context with babies, she's the one who taught me some of the things. So I got the knowledge through her. So yeah, that's just when I thought, yeah, this path is for me. Apart from the spiritual episodes that I had, my mother used to tell me a lot of stories about when she was pregnant. She was told that she was carrying a healer.
Oh, wow.
Yes. So I then realized that I was chosen before my existence, before my physical existence. Yeah.
Sure. Truly a calling, hey, in the true sense of the word. Okay. So if we go into your work, what do you think, what would you say you enjoy the most about working with mothers and children and families?
Okay. The one thing that I'm very passionate about when it comes to mothers, it is the fact that they're the anchors of families. Mothers are the anchors of families, and they're just, affectionate.
Yeah.
They are involved. They're very collaborative in the lives of their kids. And also they are just, emotional beings. I just love working with mothers because they go through a lot of stages in life. And, when they come into my space, yes, they come for reasons of, they brought their kids for whatever reason. And I end up now exploring other things that are going on in their lives, because some of these mothers, they go through, life challenges, divorces. You end up now having conversations about the divorce that they're going through. Just providing support for them. Others are going through postpartum depression, separation, financial issues, there's just a lot. So I just love working with mothers.
Again, I think,
and being their support as well.
I was just thinking as you were talking that your history or your experience in the wellness and counseling space must bring such a rich diversity to your consultations, right?
Yes, definitely.
What does a typical consultation look like with you?
Okay, so firstly, people secure an appointment with me. So once the appointment has been scheduled, they then come into my healing space. And then first consultation, we go through bone reading, through divinations. That's how we find out where the problem is with the child. And then we now discuss solutions as to how can we help the child, heal for whatever reason. Yes. So, and then after that, because usually my rituals, there are some rituals that I'm supposed to do outside of my practice, because cases are just different. Yes. So all of my treatments are not one size fits all. Yes. They are tailor-made for every patient.
Person. Okay. So the bone reading. So I don't arrive and say my child's got a cough.
No, you don't.
Okay. So I basically come and I'm like, I'm here, help me.
Well, I do not divine each and every patient, but because usually I take about 10 patients a day, because I only work on appointment based. And in that 10, probably I, consult about 6 or 7. It depends, because remember, I'm working through the spirit. So if I have something to say to you, or if I see something, then we're going to have a discussion about that before we could get into why you're here.
What conditions would you say you see a lot of?
A lot of conditions. Okay. One of the conditions that I see babies for using the traditional approach, it is rituals that have to do with Ibala and Inyoni. Well, unfortunately, some of these I cannot
Don't have English
translate
words.
them in English. So it is Ibala, the mythical bed, which we believe, people that believe in African spirituality, we believe that Ibala and Inyoni are closely associated. Ibala, it is the stock bite, an angel's kiss. A lot of medical pediatricians refer it to what's the strawberry marks as well? Yes, that's Ibala. And then Inyoni is when a child, it's a mythical bed where a child would go through a lot of diarrhea and then their frontal is sunken. So we believe in African spirituality that if the child is not treated, Ibala, they basically could basically lead to one of the infant deaths. So yeah, I treat Ibala, I treat Inyoni, and then there's what we call ukudliwa. That's where a child has infection on their genital areas and on the anus. I don't know if that's the correct medical term.
Around the bum area.
Yes, we call it ukudliwa. So yes, so it's Ibala, Inyoni, ukudliwa, and epilepsy as well. Yes, epilepsy and just kids that have been possessed by evil spirits, the kids that are sleepwalking. Yes, so I just deal with a lot of things. That's what I can think of at the moment. But yeah, so kids that are going through, kids that have issues with their sleep, we perform rituals through exorcism. So that's just how I help. That's yes.
All right. So for all the patients that see you, right, and are diagnosed with Inyoni or Ibala or, any other condition, right, there's equally feasible or plausible medical explanation that I could give, right? And I think that with this, it's kind of taught me that we need to be more collaborative. What does an ideal world look like between us in terms of what we are giving to our patients? What does that collaboration look like in providing the best care for them?
Okay, so basically, you need to understand how a person, not per se how a person has been brought up, but just to respect that all of us are different and we believe in different things, and just to accommodate a person on what they believe in as much as you have the medical and the medical background and the medical explanations with regards to Ibala. Some people, they just believe that ingane needs to be taken through a traditional healer before a medical pediatrician or medical doctors. Especially a lot of Africans. I've worked with a lot of Africans and Hindus as well, because they have rituals that they perform on their babies before they could be taken to a medical doctor. So it's about understanding and accommodating people. Yes, and that's just how.
And I guess in the richness of our diversity, I guess in kind of appreciating our patients holistically, we also need to understand that they come from different generations, different advisors over the years, and it's not all necessarily one size fits all, like you were saying. Okay. Do you think that there is a traditional practice that has been bastardized or poorly understood by Western medical professionals like myself?
There are just a lot of illnesses that have been misunderstood, in my opinion. Like we were discussing Ibala, a lot of medical doctors say Ibala, it's harmful. It will go away. Just, don't do anything to the child. So we believe that people that believe in African spirituality, we believe that it needs to be treated because it is a life-threatening illness. That's what we believe. So I think there's a conflict between traditional healers and medical doctors when it comes to such illnesses. And also ukudliwa, because I had a lot of patients that would come into my healing practice and they would say, Gogo, I've taken my child to a pediatrician and they gave me antibiotics, but these sores under the baby's genital, they can't seem to be, healing. So what is the solution? There are other traditional solutions that I do perform to babies. So I think it's about what you know as a medical doctor and what I know as a traditional healer.
Yeah.
Yeah.
And I imagine it brings a lot of kind of tension or conflict between
Definitely.
us and our patients, and also between patients and their families.
Precisely.
If you have a grandmother that strongly believes, because every other child in that generation that she has raised has gone through the traditional process.
Definitely.
And this new age mom who's saying, well, my pediatrician says no. My pediatrician says,
yes, definitely.
Let's not do that,
yeah,
right?
definitely.
So it brings a lot of tension. And I think what you said, very clearly is that I think from our part, we need to be more understanding and we need to be more tolerant of things that we don't necessarily understand.
Yes.
I think are there aspects of Western medical care that you still refer to, that you still think are relevant in your everyday practice?
Yes, there are just a lot of medical referrals that I, suggest to my patients, even though we use a lot of our rituals, even though we use a lot of our rituals through African cosmology.
Yeah.
Because sometimes, especially with patients that have epilepsy, I would just ask if they have gone to the doctor before, what results have they gotten?
Okay.
Have they done tests to prove that they are epileptic?
Yeah.
Brain scans, any abnormalities on the brains.
Okay.
So I do explore the medical part of healing. Yes. I don't just focus on the spirit said, divinations, bone reading, or what I want to say to that patient.
Yeah, that's actually so assuring. It's actually so reassuring that there is because I think the thing with traditional medicine is that we don't know a lot about it, right?
Yeah.
So it's almost shrouded in quite a lot of secrecy and hidden
sacred
things. Yeah. So I think where people don't understand, there's so much room for misinterpretation and misunderstanding.
Yes.
So it's actually so reassuring that that there is that you do ask about scans and tests and investigations, and then kind of tailor the treatment according to that. That's very holistic, which is beautiful. It's not something that that I was aware of, But so are there conditions where you've told patients, please go to the hospital?
Definitely.
Okay.
TB.
Okay.
Kids that are autistic.
Okay.
Because I don't think there is, in my opinion, I don't think there is any traditional medicine that can help an autistic child, because autism has a spectrum.
Yes.
And I just cannot deal with that.
Yes.
So I do, I do some parts of traditional healing to a certain extent, but then going forward, I just refer the patients to consult with the doctor or to a hospital to get help, medical attention. Yes.
So that's very interesting for me that you would mention, our neurodiverse conditions like autism, because they are so poorly misunderstood.
Yes, because
Even
a lot
medically.
of, sorry to interject, because a lot of patients, when they come into my healing space, they say that, Gogo, I don't believe that my child is autistic. Probably there was a spell that was put on my child, and people need to understand that for a child to have autism, it's a genetic issue or ill condition. Thank you for that. It's a genetic condition. So I just take them through a moment of acceptance on, there was no spell that was put on your child. It's just, one of those genetics issues.
Yeah. And I think, again, autism is a tricky one because it's multifactorial.
Yes.
So there are possibly genetic factors, there are environmental factors at play as well. That is even misunderstood by Western medicine.
Yes,
that's
definitely.
quite difficult and quite challenging in terms of getting treatment and in terms of getting them to a diagnosis.
Yes.
So I can imagine that for a lot of parents, particularly parents that are rooted in African spirituality, that it seems like a feasible thing to go to a traditional healer. And there's probably a lot of, but like, why can't you help me? With something like that, because I think it's a very difficult condition for a child or a family to be living through. So on the flip side, right, are there conditions where you would encourage a pediatrician like myself to say, I think rather consult Gogo with this one?
Well, that's a difficult one to say because, medical doctors or pediatricians, they just know the scientific part of healing. And a lot of our rituals, they were not tested. They are still not regulated. They were not tested like through, medical practices. So they are still not regulated. So it's very difficult for you. And also conflict of interest as well. Because remember, doctors are still, are registered under a professional body. So you cannot just, refer someone outside your fraternity. So I think you would have a problem with conflict of interest.
Absolutely.
So honestly, I don't know how to answer that.
There aren't too many conditions. So for parents who feel stuck and unsure, right? What do we say? Probably try both. Probably have some tolerance and patience.
I think you could just explore that with the patient and, just ask them where they are in terms of traditional healing, part of everything, and medical attention. Like, just explore their views around that. I think that could
and find a way to meet in the middle.
Yes,
I would think. And not bastardize the other. Right?
Definitely.
Because then it's probably kind of more Western to the traditional route, where there's a lot of bastardization that comes just from not understanding.
Yes, definitely. And it happens
you
a lot.
Went there.
And it's real because, some of my patients, they would even come and tell me, Gogo, when I went to the hospital, the nurses were asking, what is this that you put on the child? Yes. So, yes, they do that a lot. So, I think it's about being sensitive around it and respecting what another person believes in. Because, in African spirituality, when we heal babies, there are items that we put on the babies for protection, purposes. There is also traditional medicine that we apply on the head, etc. So they become so uncomfortable when they come into medical settings because they get questioned a lot about those things.
Absolutely. Guilty as charged. Because I know there've been a lot of situations where, I've seen a patient and I've said, where did you go? What did you do? And again, probably coming from a place of not understanding.
Yes, definitely.
You so correctly mentioned the fact that for us, probably a big part of the anxiety comes from the fact that we don't know.
Don't have education about it.
We don't know. And like you're saying, a lot of the products haven't been tested. We don't know how it's metabolized in the kidney or how it's going to, pass through the liver or through the gut or long-term side effects. And I think our anxiety comes from the fact that with science, we want to know.
Prove everything.
But I do think that anxiety mustn't come with judgment or intolerance of something that we don't necessarily understand. And that's something that I've absolutely come to learn, with the community that I serve.
Yes, and a lot of our work is not documented as well. I think that's where the problem is. A lot of traditional healing practices are not documented. I think that's where the problem is as well. So every knowledge or every ritual that we do, it is something that has been passed on from our forefathers, And that's just, so in order to be comfortable. You need like a source of a person to say this mutu worked for A, B, and C. So through word of mouth. So it has never been proven, it has never been tested anyway, and it has never been documented as well.
And like you said, it's not one size fits all, right?
Exactly,
So the cause for my tummy pain may be different to the source of your tummy pain.
Definitely.
I think as a guide to parents, just like in, the Western medical fraternity, we get some kind of unethical medical care providers, that do dodgy things, right? And where there are some red flags, in your consultation or in your interaction with a professional, you are questioning certain things and how they've been done. Are there red flags in your profession as well? In terms of traditional healers, are there things that parents should be wary of when they've come to see where something is just feeling like it's not going right, or are there things like that parents should be wary of when consulting with a traditional healer?
Definitely. In my knowledge, there are some things that, now that you mentioned about ethics, there are a lot of things that traditional healers do wrong, because remember, we do not belong in any professional body. No one
no
is
code of conduct.
Yes, we don't have any laws that bind us that we're supposed to do A, B, and C. So there's just a lot that goes through traditional healing practices, because some traditional healers, they go to an extent whereby they would have relationships with their patients, and for them it's
normal.
It's normal, it's okay. And if I were to compare that into the Western medicines, that you could be in trouble for that, because of the HPCSA regulations. So there are just a lot of, things that are going wrong in the traditional fraternity. Some traditional healers, they sexually violate their patients and nothing happens. No one gets arrested, So there's just a lot. I can mention a lot of things that go wrong into the traditional healing practice. And also remember, some of our rituals, even the processes on how we do things, some of our rituals, we use razor blades to, cut the patients during rituals that we perform to these patients. Some people, they do not, practice safety precautions to patients, they just do stuff that shock me as a traditional healer as well.
It's not sterile. It's not always sterile.
Yes.
Okay. So in closing, this has been an eye-opener for me, right?
Yes, doctor.
If you had to leave parents with one message, what would it be?
Okay, coming from a person who's a spiritualist, I would give parents an advice that I believe that we're spiritual beings who are just having a human experience, and that parents need to be gentle with themselves, because often we put our kids first and we forget about ourselves as parents. So, just be gentle with yourself, give yourself grace, and understand that motherhood or parenthood is a journey, and it's not a one-size-fits-all type of thing. It doesn't even have a manual. So give yourself grace and be gentle around yourself, and that you need to, everything that you do not seek for perfection, because yes, as parents, you would think that your child, they internalize things that they see through you. So just be gentle and allow yourself to make mistakes as a parent. It's okay. It's allowed. So that is the one message that I would give to them.
I think definitely your experience as a wellness counselor coming through that, because that was actually so containing.
Thank you so much, doctor.
But thank you so much for joining us today. I've learned so much and I leave so enriched. And I imagine it's the same for our parents as well. And there you have it, parents. Thank you to Dr Nomadlozi for sitting with me in the space of mutual respect, curiosity, and kindness. Until next time, stay kind and stay curious.